about the blood supply of brain cortex, cortical area of brain. There are three major groups, the three major blood vessels which are supplying our cortex area, which is the in the front part, as the name suggests, the anterior part, the anterior cerebellar artery will be supplying the front part of your brain cortex. As the name suggests, posterior cerebral artery, it will supply the posterior part, and the lateral part, the middle cerebral artery, is not supplying the middle part. Middle is not with the middle. Middle is supplying the lateral part. So the lateral part of your brain is supplied by middle cerebral artery. And if we divide the brain, if we cut the brain from the middle part and divide it into two parts, the medial section will supplied by anterior cerebral artery. We should also know something about homunculus. Just imagine karo कि this is a sofa. This is the lateral part of your sofa and this is the middle part of your sofa. And एक man है which is lying from the face and the upper limbs like this. Okay. So the facial part and the upper limb parts are lying in the lateral part of your brain. So it will be supplied by middle cerebral artery, and the lower limbs of the man and the perineum part. This is lying in the medial part of the brain cortex. So it will be supplied by anterior cerebral artery. It's very easy. Just imagine a man lying from the sofa. This is the lateral part of your sofa, and this is the medial part of your sofa with the upper limbs in the lateral part. Then we come to anterior cerebral artery stroke. If the anterior cerebral artery is being affected, it will cause, of course, if the anterior cerebral artery is affected, it will cause a stroke in the anterior part of your brain. And as we all know, anterior part we are having frontal lobe, which is responsible for your personalities. So it will cause your personality behavioral changes. And as I explained before, the anterior part is supplying the anterior cerebral artery is supplying the anterior part, and it is also supplying the medial part. And the medial part is having the lower limbs and the perineum part. So, since the perineum part is being affected, the abdominal part is being affected, it will cause urinary incontinence. It will cause antisocial behavior dysfunctions, and it will cause release of more reflexes. The Babinski sign is, for example, the Babinski sign, which is present in the childhood, the neonates, it will become again in the adults. And the lower limb weakness. How we can remember this? So there is an easy mnemonic. Just draw एक man बनाओ ऐसे करके, and then एक man बनाना है ऐसे करके, and then you have to make the legs of your man like this. So this is supplied, lower limbs are supplied by anterior cerebral artery. Now we will study about MCS stroke. What if your middle cerebral artery is being affected? As I said before, the middle cerebral artery is not supplying the middle parts, it is supplying the lateral part of your brain, and the lateral part of your brain contains what? So, lateral part is containing the facial part and the upper limbs. As I said before, the facial part and the upper limbs are in the lateral part of your brain. So, it will cause upper limb plagia and aphasia. How we will remember this? So again you have to draw a man with the legs like A, and then you have to draw the man upper limbs like this. So middle cerebral artery is supplying the upper limbs, so it will cause upper limb plagia. And aphasia, because all the areas, the Broca's, as you all know, the speech areas is named as Broca's area, Wernicke's areas, angular gyrus areas. These all things are present in the lateral part of your cortex. So whichever whichever area is being affected, whether it is a Wernicke's area, Broca's area, and angular gyrus, the type of aphasias will be different in all these parts affected. Agar Wernicke's area is being affected, it will cause fluent aphasia. How we can remember this? So Just imagine वर्निके वर्निके एक इंग्लिश मैन का नेम लग रहा है. ओके, इंग्लिश मैन फ्लुएंटली इंग्लिश बोलता है. इंग्लिश मैन स्पीक्स फ्लुएंटली इंग्लिश. सो अगर इंग्लिश मैन को इफेक्ट हुआ, then it will cause fluent aphasia. Then how we can remember Broca's area aphasia? Broca, Broca कैसा लग रहा है? Broca is resembling like Boca, and Boca do not know anything. In Hindi, Boca is for Buddhu or Pagal, which do not know anything, don't know anything. So Broca is Boca, which do not know anything, no fluency. Okay, he do not know how to speak also. So non-fluent aphasia will cause if the Broca's area is being affected. And the angular gyrus is a communicating part which communicates with the Wernicke's area and the Broca's area. So if the angular gyrus is being affected, so A for A, it is easy, anomic aphasia will be happening. Then what about PCA stroke? Whenever there is a PCA stroke, what I said before, posterior cerebral artery is supplying the posterior part of your brain. And posteriorly, we have occipital lobe, which is responsible for your visual areas. So whenever there is a visual area defect, we can say that there is a posterior cerebral artery involved in the stroke part. How to remember this? Again, you have to draw a man. Again, you have to draw a man with the legs. This is for anterior cerebral artery stroke. With her upper limbs, middle cerebral artery stroke. And the man is wearing a glasses like P. So this is posterior cerebral artery stroke. And the man is having a big lips. Okay. So whenever there is a PCA stroke, it will cause visual defect and there is a phenomenon whenever there is a dominant part of your brain is being affected, the posterior dominant part, there will be a symptoms like apraxia, finger anomia, right-left confusion, acalculia, and agraphia. Then how to remember this? Whether it is a dominant part defect or non-dominant part defect? It's very easy. Whenever there is a dominant part defect, just imagine एक dominant banda है and dominant banda is always putting finger on others. Okay? So when the dominant part is being defected, there will be finger anomia. एक dominant banda है is he or she is very like intelligent in doing all the calculations to draw all the graphs. So whenever there is a dominant part defect, there will be agraphia, acalculia, finger anomia, and right left confusions. And whenever there is a non-dominant part is being defected, then it will cause all the other symptoms like dressing apraxia. There will be the person will not know how to dress. The person forgets, भूल जाता है person कि उसको like shirt कैसे पहनना है. That also he forgets how to wear a shirt also. Then topographical apraxia will be there. Normally, what happens? Like we know in our room where is the switchboard? Where is the switchboard? So अगर आप कभी enter करते हो अपने room में and all lights are switched off, then also you know that in this direction my room is having a switchboard. You can go without saying you can switch on the light. But in these patients, they do not have topographical like orientation is present, so they can't switch on the light when there is a lights are switched off. Okay. Then hemi neglect. इसमें क्या होता है कि एक person है, he just neglects half part of your body. Okay, half part of his or her body. वो नहा रहा है बंदा, एक पार्ट में से सोप लगाता है, शैम्पू लगाता है, everything he puts on is half part, and half part he just neglects. When he just shaves his half part is bearded, and half part will be well groomed and well shaped, like this. Then constructional apraxia, what it means? When you will say any patient to draw a clock like this, we normally draw like this, like this, like this, like this, like this. Okay. But in constructional apraxia, the patient is unable to draw a clock. He will draw it like this. He will draw it like this and this. This is not a clock. Okay. He will not, he is unable to draw a clock like this. He is unable to draw a circle like this.